Hey, what's up, man? How you doing?
Hello, hello. How are you?
I'm fine, thank you.
Dude, are you ready for your 73 questions?
I'm too ready. Let's get it.
Dude, well, let's get started.
Awesome.
Beautiful, beautiful place in a beautiful city.
I appreciate that. Come on in.
So,
Yeah.
what is your name?
Kojo Sarfo.
And your medical specialty?
I'm a mental health nurse practitioner.
Okay. And how many years have you been a nurse practitioner?
Since May of 2019. So that's going on almost 3 years now.
Okay. And now people may know you as Dr. Kojo Sarfo.
That's right.
And many people don't know what a DNP is or the difference between a DNP degree versus an NP degree.
Right.
And both are classified as a nurse practitioner. So
That's correct.
Can you explain the difference?
Right. So it used to be the nurse practitioner degree was a master's level degree, right? And then as of late, they're shifting, within nursing, they're shifting towards, their practitioners having a doctoral degree, right? So a DNP is a nurse practitioner who has that extra education. So you go to school for about a year and a half more, and you learn more about research. You learn more about how to advocate for your patients. You learn more about how to advance the profession a little further. So the difference between a DNP and an NP is the level of education, but clinically, it's actually the same exact thing. Yeah.
Really good to know.
Yeah, people don't know that.
Exactly.
Awesome, yeah. Well, I'm getting set up. Today is a recording day, so we can go on upstairs.
Sure, let's see where the magic happens.
Come on.
All right. We'll keep things rolling. Where
For
did
sure.
you go to undergrad?
So I went to undergrad at the University of West Alabama, and that's in Livingston, Alabama. Yeah, super small school.
And where did you get your DNP from?
I got my DNP from Augusta University, which is the #1 DNP program in the nation.
Go Jags.
Go Jags, yes sir.
Oh, and where has your clinical experience as a DNP taken you?
It's taken me all over. So initially I started in Williamsburg, Virginia, and I was working at the oldest psychiatric facility in the U.S. And after that, I moved to Los Angeles, California, and I did some telepsych work here from, my computer, but I'll see patients in Arizona, Virginia, all over.
Okay. Now, what was your favorite part of NP school?
My favorite part of NP school was actually the rotations, getting to shadow the psychiatrists and the psychiatric nurse practitioners, and it motivated me to finish the program so I could actually be in their shoes one day.
Yeah, it's a powerful experience to see real patients.
Yeah, no, it is. It's great.
So, what made you first fall in love with the NP field, particularly within mental health?
So great question. So when I was working back at the psychiatric hospital in Augusta as an RN, I ran into some nurse practitioners who were doing a job role that was very similar to the psychiatrist. And I was like, what is this role? I had no idea what it was. So I asked the psychiatric nurse practitioner, what she did and how, it was so similar to what the psychiatrist did. And I saw that she was prescribing medications and she had a bigger involvement, on the team. And I was like, whatever that is, I'm interested in that thing.
For sure. And now there's probably some people out there who are interested in pursuing this career. Mm-hmm. And for those curious, how long does your training take after undergrad?
So after undergrad, you can actually get a nurse practitioner degree in about 2 years or so. You get a master's degree, 1.5 to 2 years. If you go for the doctorate path, that could be about 2.5 years though. It's a little longer. For me, I wouldn't say it was 3 years at Augusta University, so quite the journey.
So this is also why I love highlighting non-physician fields, because there's plenty of opportunity as an
That's
NP
correct.
or DNP, as you so brilliantly highlight. Mm-hmm. Are there any further subspecialties that you can do as an NP or DNP? Like for you do mental health and psychiatry.
Correct. Right, so you have, the acute care nurse practitioner track, you have the pediatric track, you have nurse practitioners who do family NP, general practitioners. So that would be the nurse practitioner equivalent of a primary care, doctor, physician. You have nurse practitioners who are even going to the aesthetics route. So it's so versatile. You have nurse practitioners who are actually able to even assist, some physicians with surgery in a limited role. So it's so versatile to the point where me, the psychiatric nurse practitioner, I have to ask my friends and my peers who are nurse practitioners about, what they actually do.
That's awesome.
Yeah.
Plenty of opportunity.
Yeah. And you want some water, by the way?
Sure,
Yeah.
take some. It's hot out here.
Yeah, it is.
Oh, did you ever consider getting other degrees like an MBA or an MPH?
I never did. For me, it was really just between the DNP degree at Augusta University, and the only other option was to, become a psychiatrist.
Okay. What would you say is the most unique part of your field?
The most unique part of my field is probably the versatility, because sometimes as a nurse practitioner, you're still a nurse, right? That's your background. So you have that nursing background, and then you're a provider. So now you're similar to, you're doing the role of what a physician would do clinically. And then also sometimes you're doing the things that the social worker would do. So it's such a versatile career path. And I didn't even know how versatile it was until I got into it.
All right. Now, I always give everyone the chance to sell their healthcare career, kind of like a car salesman.
Right.
So why should someone choose a career as an NP?
You should choose a career as a nurse practitioner if you're someone who you want to have a higher, like a bigger role within the healthcare team, and you have a love for the patients. Like it all comes down to the patient. It's patient-centered care. So especially if you're a nurse and you want to go and get more education, the nurse practitioner track is a fantastic track because it's linear, like it's on that path for you. Whereas if you wanted to go to medical school, you'd have to kind of like reverse course, organic chemistry, all those different courses that you know about, of course.
Mm-hmm. Now, flip it around.
Right.
Why should someone not choose a career as an NP?
Oh, there's so many reasons. You should not choose a career as a nurse practitioner, if you want to go into it for the money. That's the first thing. And you should also not choose a career as a nurse practitioner if you truly want to be a physician. I always tell people that, because if you always thought about being a doctor, like a physician, MD or DO, you should not go for the NP path. And it's not settling. It's just that if that's what you want, there are some key differences. So you should go for the career that you actually want. Good question.
Very well answered, too. Now,
appreciate it.
What would you say is the most unique part of your particular specialty within mental health?
The most unique part about my specialty is the fact that I think it's the way we prescribe the medications, actually. And in different states, there's certain substances that you can't, prescribe, with the DEA Schedule 1, 2, 3, 4. But being able to prescribe medications and recommend therapy, I think that's huge, because there's a mental health crisis. So people used to think, okay, only a psychiatrist could prescribe medications. But being able to get into that space and have the option to prescribe medications or not, I think it's amazing. And also sometimes the right choice is not to give them a medication. So just that decision making is pretty cool.
All right. Now, I know you previously were actually at my medical college as a professor, faculty member.
That's correct.
I never got a chance to meet you then, but it is obvious you have a great passion for education. So
that's correct.
What would you say is your favorite part about teaching students and being around students?
It's the curiosity. When you have a student who is curious about anything, you have their attention. The way that they look at you, you can tell that you have their full undivided attention. And that at that moment, you can impart any knowledge that you want on that student. So when I was back at Augusta University and I was taking the nursing students to the psychiatric hospital, there's very few people who will get a chance to experience that, from that perspective. So getting to let them talk to the patients and to see how their eyes would light up when they realize that these are real human beings with real issues, that was super cool for me.
Would you ever go back to an academic setting as a professor?
In a limited role, potentially. I thought about that.
Yeah. No, it's a tough question.
It is a tough question.
So I know a lot of your days now kind of revolve around your work on social media, but when you were working clinically,
correct,
what did an average day look like for you?
When I worked clinically, an average day, it looked like me getting to the office early. I wanted to beat everybody else there. I wanted to get to the office around maybe 7:05. The day started at 8. I would get there and then I would look and see who the new admissions were. I would go in the unit and I would talk to them, just briefly introduce myself, and then I would go look at their chart. And then I would read a little bit about the patient, and then we would have a treatment team meeting around 9 o'clock. After that, we would, as a team, go talk to the patient, and I would go back and look through the records more and decide what medications they need, what's going on. And then after lunch, we would have more meetings where we would meet with the patient and sometimes with their family members, and we would discuss, the plan of care. And because I was working on the forensic unit, we were working with the psychologists. Sometimes we were working with the judges. I would have to go to court on behalf of my patients. So no 2 days were alike. And sometimes you have behavioral issues on the unit where you may have to come in and help a patient who is struggling. Maybe they haven't slept in a while. Maybe they're aggressive. There's so many things that you have to take care of that you can't really prepare for. So I'm always on my toes, just making sure that I can help out whenever help is needed.
That's awesome.
Yeah.
Now, can you describe your typical patient interaction as a mental health DNP?
Yeah, so I would go up to the patient and I would say, hey, my name is Kojo or Dr. Sarfo. A lot of patients like to say Dr. Kojo. So I say, hey, my name is Dr. Kojo. I'm the psychiatric mental health nurse practitioner, and I'm going to be here to take care of you. I'll be in charge of the medications and helping out with some brief supportive therapy. And then I would ask them, my first question would be, have you eaten today? Like, have you got some sleep? Are you good? And as we would build that rapport, the patients would tell me why they're at the hospital and what they actually need. And then we would go from there.
Yeah.
Yeah.
And now, next question, because it's going to be important to me and many people watching.
Okay.
What is your typical interaction with physicians and residents?
That's a fantastic question. So you would interact with physicians every single day. So I would go to the hospital and, there's a psychiatrist who was across, from my office. And anytime that I had a question, I would ask her. And, when I first started in the state of Virginia, you have to have, now it's 2 years, but back then you had to have 5 years of practice underneath a licensed psychiatrist before you can have, be on your own. So I would have monthly meetings with the medical director, and we would talk about difficult patient cases. We would talk about medication management, and we would talk about ways to improve for me as a clinician. So that was really cool. And also a lot of times you'd see residents come through and they were always curious. So sometimes I would ask them questions and they would know it. They would know some things that I wouldn't know, and likewise vice versa. So we would just talk back and forth and just kind of, trade ideas and figure out what we could do to help out the patient.
It's awesome. All about teamwork.
Yeah, teamwork is important.
Absolutely.
Yeah, you set this camera right here.
Sure. Now, what is the most common question you get asked by your patients?
The most common question that my patients ask is, back in the inpatient setting, they would say, when can I go home? Because a lot of them,
I feel that.
Like they've been there for weeks and months and, they just want to go home to their family. So they'll ask, when can I go home? Yeah.
Now, what is the most memorable patient encounter you've ever experienced?
Oh, wow. I had a patient who, first time I came in, he didn't like me at all, cursing, all this, that, and the third. And we came in, we rearranged his medications, and I talked to the psychiatrist across from me, and I was like, have we started him on Clozaril before? And she was like, no. So I went through all of his records, like 2 huge binders. We put him on Clozaril, and he just changed completely. He was the most pleasant human being, and he was able to get a discharge like 2 months after. And we threw him a party, and we were all so proud of him, and I'll never forget that.
That's awesome.
Yeah, super cool.
Now, we'll get a little bit to the dirtier side of medicine,
Right.
the next question, because mental health work, it's rarely pretty.
Right.
And it meets people in some of their most intimate moments. So what was one of the hardest conversations you had that left an impact on how you care for others?
Wow, what a question.
Yeah.
Yeah, I remember, talking to a patient of mine. I want to say she had bipolar disorder, extremely intelligent, young lady, and she had been readmitted for like the 3rd time. And, she was finally coming to accept her diagnosis, and she was crying, and, I was having a conversation telling her that, you do struggle with this, disorder, but with the proper help, you can live your life. But just seeing her like accept her diagnosis, it was like a beautiful thing, but also a heartbreaking thing, because like it cuts deep into your identity. So I could see she was struggling with that. But just me having to, I had seen her before, but having to tell her that, hey, you do have this thing, a lot of times it does require treatment. And that third time that she came back in, I could tell that she really got it, and she was like fully committed to following through her treatment. And I hope she's doing good today. I'm confident that she's living her best life.
That's awesome.
Yeah.
Now, what is the most common mental health diagnosis you see?
For me, because I did the bulk of my work in, forensic psychiatry, I would say schizoaffective disorder, either that or schizophrenia, But then after I left and I started doing, telehealth, it was probably, depression and anxiety.
Okay. Now, what is the most common treatment that you use for those diagnoses?
For patients, who have schizoaffective disorder or schizophrenia, we use a lot of antipsychotics, and a lot of those patients opted for the long-acting injectables. They can take it once a month or once every 2 weeks. And for those with depression, anxiety, normally we start with antidepressants or anxiolytics.
Okay.
Yeah.
Now, what's the most common medical advice you give to your patients?
The most common medical advice that I give to my patients is for them to pace themselves. Don't go too fast. Because a lot of times, like when you leave the hospital, like you're trying to make up for lost time. Like you've been in there for sometimes a half a year, weeks. So you get back out there into the real world, and you want to like make up for lost time, but you can't do that. So you have to be kind to yourself. And even if you're not hospitalized, if you're coming out of a depressive episode, be kind to yourself. You're going to work your way back into it eventually.
Really good advice.
Yeah, appreciate that.
What is the toughest part of your job?
Oh, the toughest part of my job, I would say, is when you have to, I always say that in order to be good at this job, sometimes you have to be a little drained at the end. And the toughest part is when you have to kind of go to that place of pain where the patient's at, and sometimes just sit there. You may not have to say anything. Silence is therapeutic, but you have to just take yourself to that place sometimes. It's tough, but it's also gratifying because they can see that you care.
Absolutely.
Yeah.
Now, on a more positive note, what is the most rewarding part of your job?
The most rewarding part of my job is probably discharge day, back in the inpatient environment. When a patient is getting ready to go home, they're excited. And the same patient that you get when they come in is different from when they leave. They're happy and they're energetic and, they're hopeful. So that makes me happy.
All right. And as you're setting up all your lighting and stuff, now your work as a DNP now revolves around your outreach through formal publishing mediums and social media.
That's correct.
So what does a typical day look like for you now?
A typical day for me, it looks like me waking up in the morning and I read my daily report from my assistant. And, we have a list of videos that worked the previous week. And then we look through those, and then we also figure out what do we want to post this week? Like, what do we want to focus on? Most times it's talking about ADHD, anxiety, depression, but sometimes we also want to make funny videos. So we might want to make, comedic skits to make people laugh. Or sometimes I'll be right here on this couch, and, I'll have my roommate join me, and then he'll put on, like I actually bought like a patient outfit. So he'll put on a patient outfit, and he'll be here on this couch, and I'll be playing the provider in the background, and I do my little dance. So we like to have fun with it, but it is a lot of organization that is involved, having to read reports from my assistant and trying to stay in line with what I actually want to post.
Sure.
Yeah.
Now, some quick fire questions.
Sure.
How many hours do you work in an average week?
Probably between 50 and 60.
What time do you normally wake up?
Normally wake up ideally between 5 and 6 a.m.
What time do you normally put everything down for the night?
Between 10 and 11.
How many hours of sleep are you typically working on?
On average, middle of the week, 6 to 6.5.
How many hours of sleep are you working on right now?
Right now, it's Saturday, so it's like 8 hours of sleep.
Well earned. Now, what made you make the switch to almost, or practically, full-time social media? Something very few healthcare careers would even give opportunity to do.
Yeah, so, I was posting on social media part-time, and then I was, doing my full-time practice in the inpatient hospital. And by November 2019, I got to around 300, 400,000 followers on social media, and I felt like I had an opportunity to really take it to the next level. And back at the hospital, I had like my 25 patients who, like, I knew everything about them. I felt like I was doing the best I could to take care of them. But then I realized I had like another 300,000 people that I could impact on a higher level. And I figured that if I put more intentionality behind it and more effort, that we could get to the place where we have millions of people who are learning about mental health. And that's what we've done. So it was a scary move, and it's still scary, but I feel like we're helping a lot of people.
For sure.
Yeah.
And what are some opportunities or experiences that you never thought you'd be able to have if not for social media?
Wow, I think without social media, I wouldn't have been able to reach so many people through my live streams, through the videos. I've had a chance to, out here in Hollywood, go to, red carpet events, to meet people, to speak at events, to speak for TikTok, to speak for Facebook. And the average person, I've been shocked by how much, they want to learn about mental health. So being able to get invited to these different events, as a medical professional, and the fact that people want to hear what I have to say, like that's quite shocking. I'm very grateful for that.
Awesome.
Yeah. Move this over here.
I don't know if you can say the answer to this next question, but what is the coolest, quote unquote, famous person that you've ever interacted with?
The coolest famous person that I've interacted with? My goodness. I mean, I woke up to a voice message from Demi Lovato one time about, she told me that she liked my song that I put on TikTok, which was great. But that's probably the second. The coolest is my childhood idol, Vince Young, quarterback for the Titans. I actually was able to, I DM'd him, he DM'd back, and we were talking, and that was it blew my mind, because I used to watch him on TV, and I was like, Vince Young, so for him to, be interested in what I'm doing with mental health, that was super cool.
Whoa.
Yeah.
That's awesome. No, night or day person?
I'm a night person, but I had to switch the day to run this business.
Fair enough. Who are you most thankful for on your patient care team?
On my patient care team, I'm most thankful for probably the social workers. I feel like social workers need more love. They're the ones that they tie everything together, and it's hard sometimes when, a lot of our patients, when I was working, they didn't have a lot of family support, so to have a social worker who could go and get the collateral information, from years past and bring it to me, it made my job so much easier. So I'd probably say the social workers.
That very, very underrated,
right,
and very important member of the care team.
Extremely important, yeah.
Then why is the nurse practitioner so crucial to adequate patient care?
The nurse practitioner is so crucial to adequate patient care because if you think about it, there's there's a mental health crisis today, and we don't have enough providers. So when you have nurse practitioners come into this space, we're filling this gap where we're all trying to take care of the patient, right? But without enough, providers, there's people who are going to be on the outside looking in. So the nurse practitioner role is a very important one because so many more people can get access to care just because NPs exist.
Very, very important part of it.
Yeah.
Now, we've talked a lot about your life surrounding your career. So how about when you clock out? What is your favorite thing to do when you are not working?
My favorite thing to do when I'm not working is probably play basketball at the gym, believe it or not. Nice. I love it.
Does your family ever ask you for random medical advice?
They'll ask me about, I come from a family of nurses.
Okay.
Yeah, so for my dad, mom, both nurses, all my sisters, all three of them are nurses as well. So every now and then they'll ask about a medication, maybe they'll have a patient and they'll say, oh, what does Lexapro do? I say, oh, it's an antidepressant. So those are the questions I get from my family.
Gotcha. What's the weirdest question a family or friend has ever asked you?
The weirdest question that a family member or friend has ever asked me, if I've been beat up by a patient, But that's never happened. Those things could happen, right? To be
Yeah.
realistic, but it's never happened to me. I treat everybody with respect and kindness, but you could still be kind to somebody, and something could still happen. But fortunately, I've been good so far, so I'm grateful for that.
Good, good. Any pets?
Yeah, I have one mini Australian Shepherd.
And she is adorable.
Yeah.
Favorite animal, not a dog or cat?
Kangaroo.
Good choice.
Yeah.
If you could have dinner with anyone in history, who would it be?
Ooh, dinner with anybody in history. I would probably say Bill Clinton.
And what would you guys be eating?
I would probably be eating. I know he's from Arkansas, so some type of Southern food. Yeah, I used to read Bill Clinton autobiographies. My mom used to make me read, so I was like, oh, he came from nothing, and he came to where he is today. So probably go with Bill Clinton, and we'd be eating some good Southern food.
Mm-hmm.
Yeah.
Spoken like a true Georgia guy.
Right, you know it.
What's your favorite dish to eat?
Favorite dish to eat? Mickey, Vicky. I'd probably go with lasagna. I like Italian food as well.
Okay. Any favorite restaurants around here? And I know it's hard to choose being in LA.
My favorite restaurant in LA is Mr. O's. Yeah, we have to go there. It's in Studio City. I love it.
Sure. Coffee, tea, or soda?
Neither, actually. I'm not a caffeine fan. But between those three, I'll go with tea.
Okay.
Yeah.
Favorite TV show at the moment?
HBO, the Lakers series, Showtime. Yeah, really good.
One book recommendation right now?
A book that I've always loved since high school, God of Small Things. I read it every now and then.
Your go-to spot to relax?
Probably the rooftop here at home. I can just take in the California air.
Awesome. Wish I could do that all the time.
Yeah.
Favorite social media platform?
Oh, as of right now, I'm gonna make somebody mad with this one. I probably have to go with Meta. That's Facebook and Instagram combined. The interaction there is the engagement there is so good. Yeah.
All right. Most controversial question on the list. Pineapple on pizza, yes or no?
No way.
Good. Any artistic hobbies you keep up with besides the obvious video creation?
So I like to play guitar in my free time. I'm starting to collect random things and learn about it. I just bought a ukulele, and I'm gonna go on YouTube and learn how to do that. I also like video games too, and I bought a Wii, it's right there. I bought a Wii that I'm gonna play in my free time. It just takes me back to being a kid.
Absolutely.
Yeah.
All right. Top 3 music albums.
What a question. Not in any particular order, but Take Care by Drake is on there. Then Swimming by Mac Miller is also on there. And then AI Youngboy 2 by Youngboy Never Broke Again. A really good album.
All right.
Yeah.
Now, one random task you wish you could be better at.
Oh boy, I wish I was better at organization.
You're the first person to say that.
I'm the first?
Is that you aren't the first person to say that, actually.
It's tough to keep everything together. It's
exactly.
pretty hard.
You a night in or go out on the town kind of person?
I'm a night in person. I'm just chill.
Interesting to say being in LA.
Right, yeah. I do go out sometimes, but I always prefer a night in.
Gotcha.
Yeah.
So, indoors or outdoors?
In LA, outdoors. In the daytime, actually. Outdoors in the daytime.
Oh, beach or mountains?
Beach, for sure.
Would you consider yourself more of an introvert or an extrovert?
I would say an extrovert who enjoys his time alone, if I can say that.
That's valid.
Right, okay.
I completely understand that.
Extrovert, yeah.
Now, would you say that personality trait was a factor in you choosing your career?
Most definitely, because in order to, especially as a psychiatric mental health nurse practitioner, you have to enjoy people. To some degree, right?
Yeah.
Because you're talking to people at their most vulnerable. So you have to have a vested interest and be curious about them as a person, even beyond their diagnosis.
Very, very good point.
Mm-hmm.
So we're getting close to the end now.
Okay, awesome.
And, when we wrap up, I always love hitting you guys with the more reflective questions. So
All right.
definitely want you to have a seat because
For sure.
these will be some tough ones.
All right.
Oh, first one. What did you think you were going to be when you grew up as a kid?
I always thought I was going to be a police officer.
Interesting field.
Yeah, right, yeah.
In a family full of nurses, too.
Right, yeah. For some reason, we went to London when I was a kid, and I saw a cop in a cool car. I was like, I'm going to be a police officer one day.
Now, next. Is there a different healthcare career you think you could have done?
I mean, a psychiatrist would be like the obvious answer, but it's too close to my role. But I think I could have been a dentist. Yeah.
Wow. That's an answer I didn't expect, actually.
Yeah, I mean, I'm about to do Invisalign for the 3rd time, so I know a little bit about teeth. I think I could have been a dentist or orthodontist.
Gotcha.
Yeah.
Now, if you didn't do medicine, what do you think you'd end up doing?
I've thought about this before. I would probably be like a YMCA teacher and like help coach kids who do organized sports like football and basketball. Yeah, that's super fun.
It's awesome. Now, any medical career is tough,
Right.
whether you're in NP, nursing, PT, OT, MD school, DO school. Have you ever at any time doubted that you would make it as a DNP or even to a greater extent, even be where you are right now with social media?
Yeah, I did not see this coming. And even at one point in my program, I was like, I don't know if I can graduate, like when I was in the middle of the psychopharmacology class. So I'm grateful to all of the nurses and the psychiatrists who were patient with me. But yeah, I had a hard time envisioning even me practicing as an NP, let alone all this, what's going on here in LA. So I'm super grateful.
So now, if you could change one thing about the medical field right now, what would it be?
It's too much red tape. It's too difficult to, get the patient the help that they need. I would probably make it to where providers are so much more accessible. And I don't know if that's one thing or a couple of things, but it would have to be something centered around getting the patient the help that they need. Yeah.
I absolutely agree. How a lot of people watching are pre-med, pre-healthcare, whether they're in high school or undergrad. So what can a student do right now to prepare to pursue a career as an NP or a DNP?
So I would say if you're interested in, becoming a nurse practitioner, whether it's a master's or getting your doctorate with a DNP, one of the best things that you can do is to actually watch videos like this and see what our lives are like. And if you're able to find somebody who's doing the exact thing that you're doing, talk to them. Like if you found a version of me, ask them about, their career path, their salary, how their career choices impacted their personal relationships, how it's impacted, their relationships with their parents and siblings and things like that. Really get to know that person's life inside and outside the hospital.
Very, very good words of advice, and the reason why I love doing these interviews.
Appreciate that.
Now, I asked this question to everyone. I've gotten the same answer, but it's not going to stop me from asking it.
Okay.
So, if you were to go back, would you change any of your experiences that got you to where you are right now?
Not a single thing. Not a single thing. Everything happens for a reason.
That's pretty unanimous across everybody kind of interviewed. So, finally, last question.
Okay.
What would you say to the aspiring NP or DNP right now?
To the aspiring nurse practitioner or doctor of nursing practice candidate, I would say your role matters. When I was in school, I was still really trying to figure out what the NP path was all about. And sometimes people think, or maybe speaking from my perspective, You think that when you're not a physician, that your role doesn't matter, but no role is greater than the other. And if you're an aspiring nurse practitioner, you should never think that you're less than, because it's not about you. It's not about your degree, whether you have a master's or a doctorate. It's not about the MD or the DO. It's about the patient, and it's about how you make them feel. So when you understand that you have a role on the team, just know that your role matters and that you can do something that can change somebody's life. So you should keep going if you're interested in the career path, and know that you can make a difference.
That's an excellent, excellent conclusion to this interview. Thank you so much,
I
Dr.
appreciate
Kojo.
you. Thank you.
Thank you for your hospitality in LA. And
Anytime. You're welcome back anytime. I appreciate you.
I know there's people out there really soaking in your advice. So thank you so much.
Thank you so much. I appreciate you.